I got into healthcare systems engineering coming out of an industry background in financial services. And I think when I went back to do my Ph.D. in operations management science, which is kind of the management version of health systems engineering, I was really interested in the human element of services as they relate to operations. And I think that was one of the real attractions of healthcare when I really got into that about 15 years ago, is looking at how the different stakeholders, the patients, the healthcare providers, the administrators, all had to work effectively together to create an effective system. And so I felt that with my background, I could certainly offer something to that kind of research and practice environment. I think the other thing I liked about healthcare is it wasn't just about doing things to make money for corporations that were already doing well. It was kind of giving back and focusing on the patient side of things and really focusing on doing something good for society. I think three things that systems engineering, operations research academics can take away from our conference are one, we have leaders from Mayo Clinic and leaders from healthcare in general speaking about the challenges of the healthcare environment. And I think there's a tendency in the academic world for professors, researchers to get focused on their little problem area. That's kind of the way that PhDs are trained, but sometimes we miss the bigger picture. And I think having this broad view that comes from our leaders, from some of the top speakers, and this year we're having Dr. John Noseworthy, the CEO, we're having Albert Mully from Dartmouth, Carl Clark from Denver Mental Health. These kinds of people can kind of give an overall context that I think can help broaden the research perspective of some of my colleagues. I think another thing that they can get from our conference is how research is being translated into practice. And I think, again, academics sometimes need to focus on taking their research and really making it work. And they'll, through the presentations at our conference, they'll see how organizations are actually implementing ideas of systems engineering in practice. And then finally, a third thing is I think our conference is a very collaborative experience. It brings healthcare providers and staff together with systems engineering professionals as well as academics. And I think together a number of collaborations have evolved over the years, both within Mayo and then for people kind of outside of Mayo in terms of getting new research ideas going from their experiences here at our conference.